I did want to welcome all of our municipal leaders. I know we have some new ones. We'll ask you to introduce yourself later, but we do have some new municipal leaders who have joined, and want to thank all of you who have been with us. We're in for a good discussion. This is our first one opening the season, and with that, Rich, I wanted to see if you can, and your team, start with giving us an overview of the overall COVID trends and where we are.
Certainly, and I want to thank all of you for being great partners through this. I cannot second Monique's comment more about how I wish we were not having this conversation still. For some of you, you may know that we were meeting on a weekly basis last fall, and then it kind of moved into a bi-weekly basis as things started to settle. And then eventually we decided, oh, we didn't even need to have this call any longer. And now we're back to having these calls. They're usually in the middle of the afternoon. So I know the chapter wanted to be able to do it during one of the standard evening meetings to have hopefully a wider audience. So we're thrilled that you were able to include us in this conversation, because there are lots of things to talk about when it comes to COVID, and it changes every day. And the FDA said something yesterday about booster shots, and the CDC had something different today, which I'm sure will impact all of us, because they did not recommend certain high-risk jobs for being eligible for the boosters. So I think many of us were anticipating, whether it be nurses or firefighters or police officers, bus drivers, a variety of roles of people that we employ, that is not going to be authorized for the booster shot at this point. So, but we will have Sean. Well, I don't know if Earl or Raymond, you have anything you want to start out with, because it's my impression that Sean was going to do the more of the numbers presentation for the evening.
That's right. I think that makes perfectly good sense, Rich. Sean is person who lives with those numbers most closely in HHS, and so he'd be absolutely the right person to do that piece of this conversation. And we'll chime in and share other facts that are relevant as we go through the call.
All right, I'm going to attempt to share my screen here.
So you'll be happy to know that I think, Sean, you may be presenting the pulse reports.
Yes, the pulse report, and then I did capture some of the details from today's and yesterday's meetings to share with folks. So the first part of this, I just want to share some of the most recent data. Many of you have probably been tracking along with this, but Montgomery County has been doing very well with its vaccinations across all of our sectors. Of our eligible populations, we are in the high 80 percentile for fully vaccinated, and with at least one dose, we are in the high 90 percentile. When you see these numbers over here that show for the CDC estimates of 82 and 75%, that of course includes our populations who are under 12 years old, who are not yet eligible to get back. As we track along with our cases, the CDC is now having us report cases per 100,000 residents so that they can track between jurisdictions of different sizes. And you can see from the panel on the lower left that we have been in the midst of a surge since the end of July, really going into mid-August and September. We have seen some slight declines over the last week or two in it. We are still listed as substantial transmission per the CDC guidelines, but we have seen these numbers come down a little bit, and we hope that will continue to trend down. We do track across the county where our vaccination rates are by neighborhood sector, and those in red, particularly the darker reds, are areas where we still have more populations that need to be vaccinated. We went from a few months ago a substantial portion of this map being red, down to a few areas where we're really trying to focus our community outreach and get in touch with people. We've seen that some of our populations, it has more like a wave-like function where it's taken a little bit of time to gain momentum within those populations to get vaccinated. And as you can see from the chart on the right, where there was some disparities between our ethnic and racial populations. Many of those disparities have really decreased. We're down to a 2 percentage point difference between our Black and African American residents and our white non-Hispanic residents. And you can see both of our Hispanic populations and Asian and Pacific Islander populations are at an extremely high level. All of these different groups are much higher than they are in any of the other jurisdictions, but we do try to track if there's any differences within our own county as to those levels. These numbers look a little bit lower in overall percentage points because approximately 10% of people don't include their ethnic or racial background. But it does give us a pretty good idea of how it relates across our different groups. We do track, in our hospitals do track cases that come into the hospitals on whether they are vaccinated or not vaccinated. Those cases and those hospitalizations of vaccinated individuals, sometimes called breakthrough cases, we do track that. Our county sees a higher number of those maybe than some other counties, simply because we have a larger number of populations who are vaccinated. But we have been looking at this as a proportion, and when you see that only 6% of our population is not vaccinated, again, we're looking at numbers of the 10 and up, but they make up 54% of our cases and 65% of our hospitalizations. So the risk of becoming a case or being hospitalized, much, much higher for those individuals not vaccinated than those who are vaccinated. When we look at our who is being hospitalized, it is overwhelmingly our populations who are of greater age. So those who are 50 and older are making up 80% of the hospitalizations amongst the vaccinated population. This goes a long way towards explaining why there's a concern and why the FDA and CDC has been discussing boosters for those populations. And then to look at what the county operationally has been doing, we've continued to do testing for our populations, continue to do vaccinations. You can see on the chart in the upper left how the vaccination rates have dropped, where a very, very substantial amount of vaccinations happened in late spring when the vaccine availability really came in the forefront. But we do continue to have a steady amount of new first dose vaccinations. So we keep working with our community health partners, our primary care partners, our minority health partners, and the private sector to get these vaccines out. And that's how we continue to reduce these gaps. At our testing levels, you can see notably we are seeing some additional groups come in for testing. And the numbers over the last 2 weeks, or last 3 weeks, from 5,000 to 5.7 thousand to 6,000, those are just amongst county supported testing sites across all the public-private providers. It's somewhere in the realm of 40,000 tests being done a week in our county. So there's lots of capacity for testing, both at county sites and at private sites. To put into context where we are over the last 7 days in positivity rate, we are currently at a 2.88% positivity rate. And that's the average over the last week. You can see how that compares out to the other counties in the state. We do currently have the lowest positivity rate. And you can also see our case rate per 100,000. And that rate is also quite good, although again, it still puts us in the substantial transmission category. But our rate and Howard County's rate are doing a little bit better than the other parts of the state as far as the case rates and the transmission. And then our case count over the last 7 days has been 939. It's a little bit hard to compare that between counties because of the population differences. And as you can see on the right, we show the daily positivity percentage by jurisdiction. You'll note that at the very early part of this, Montgomery County had one of the highest positivity rates in the state, and then consistently over much of the last 9 months, we've been lower than the state on average, and a lot of that we believe is because of the protective measures that have been put in place in the county and our county's residents' willingness to follow those measures. Just to cover the most recent information that's come out, FDA did meet yesterday. They recommended booster shots for the Pfizer vaccine for 65 and older and other adults at heightened risk 6 months after a second dose. When the CDC met today, they were a bit split on things, but where they had either unanimous or majority agreement was that adults older than 65 and residents of long-term care facilities would be eligible 6 months after their second dose. Adults 50 to 64 with medical conditions that leave them at risk for severe COVID, and adults ranging 18 to 49 with underlying medical conditions based on their individual benefit and risk. What we don't know yet is what those medical conditions will be, and that will be a bit of the driving force for those other groups. So we're waiting for that guidance. Again, this is just for the Pfizer vaccine. We are hoping that they will give us guidance on the Moderna and J&J vaccine, as I'm sure lots of folks who receive those will be looking to see if they're also eligible for boosters. We do anticipate that our state partners will endorse and authorize that guidance once it becomes official from the CDC. And as far as I don't have any information right here about the pediatric updates, the most recent information we've heard is that Pfizer has also presented data on that to the federal partners. And Dr. Fauci has indicated he believes that they will have made a decision hopefully by sometime in November about expanding that age range down to 5 years old. So we are certainly prepared to support the county and our partners in getting vaccinations out to those populations. One big difference between now and the previous pediatric vaccinations is that the state has authorized our private partners, the pediatricians and other private providers, to be able to receive vaccine and be part of that rollout. So we are very excited about that. We do hope as we roll out booster shots and other newly authorized groups that our private care partners and all folks who are eligible to give vaccinations have an ample supply of vaccine, and we can really avoid much of the frustrations that occurred back in the early spring. Happy to answer any questions you all might have about the data that we shared.
This is Monique. I know you did not share this data, but I want to ask the question of the data not shared. Do you have an understanding of where we are with eligible students getting vaccinated? We've gotten a couple of questions as we did our chapter survey about what MCPS is doing and if we have an understanding of how many students are actually vaccinated. Are we feeling good about just looking at the age range? I know there hasn't been a survey or anything where we're documenting specifically MCPS students, but can you tell by the demographics and who has been vaccinated where we stand?
All right, let me see if I can pull that up for the age range. So we do have from our 12 to 17, this was on one of the earlier slides, was that right now we have estimated that between 77 and 85% are fully vaccinated, and 89 to 98% have at least one dose. And so this is just of the 12 to 17-year-old population, where it's much harder for us to be as precise with those numbers because of the way the census data comes in, and we have to split it up a little bit. So our county stat folks do provide us a little bit of a range in that, but we believe it's probably somewhere in the low to mid 90s have at least one dose, and probably in the low 80% have both doses.
Thank you.
The other thing, Councilmember Ashton, that we do see is that we can extrapolate some things from what we see in the quarantine data, which is that we see very few students who are quarantining in the high school or most of the middle school, with the exception of the sixth graders. Then obviously the majority of quarantining happens in the K through 5, and obviously that extrapolates out the vaccination status, because if you're fully vaccinated, you don't actually have to go through the close contact quarantine, even if someone who is, even if someone's infected. So that tells us that we're not seeing the quarantine numbers in the lower age groups, largely because we have a very high vaccination rate amongst our high school aged and upper middle school aged students.
Monique, are you opening it up for general questions, or are you only reading the questions that you had received in advance?
I think we're just talking about data. We do have some specific questions about county approaches, Rich and team. So I know that you normally have a multi-part presentation, so let us know if you're ready for us to go broader or if we're sticking on the data piece right now.
I think we're ready to just answer your questions.
We'll give a real general update on the schools, I think, just because, and Dr. Crowel may want to jump in on this, because obviously they met with MCPS earlier today to discuss some additional things. We're in the process of obviously rolling out we've rolled out rapid testing to all of the schools, focusing principally on the elementary schools where it has the most consequence, but making it broadly available across the system. I think last week we did approximately 1,000 rapid tests, and we had approximately 15 positive cases that came through the rapid testing process. The remaining 79, I believe, cases or 80 cases that came across the system for MCPS did come from parents reporting a positive test that was taken at home or through a PCR at home. And those students, obviously, those were reported through that system as opposed to through the rapid testing. To work with MCPS, I think, to improve their process for identifying close contacts. There still are some challenges with that in the classrooms. They aren't able to effectively implement distancing in certain circumstances that would eliminate the need to quarantine larger swaths of students when you do have a positive case. So that remains a work in progress. But we have received great feedback on the benefit of the rapid testing that has been implemented so far to reduce the number of students that need to quarantine, as well as the knowledge that parents now have of their kids' status when they're sent home with some illness. And so that remains an area of focus, and we're going to continue to work with the school system to keep improving that system. But I just want to get that update of progress that's been made. Dr. Crowel, I don't know if you have anything to add.
Thanks, Dr. Stoddard. Yeah, I think that you've covered it pretty well. The challenge with us is standing up rapid testing and making sure that as many of our students who come in symptomatically can be rapid tested as possible. It's been a game changer in terms of the number of students. Before we went to rapid testing, children who showed up symptomatic and had signs of COVID, we were in the position of, do we just send them back to class or do we quarantine? And we opted for a more conservative approach of sending symptomatic students home and then identifying close contacts with those symptomatic students, especially those symptomatic students who had some known contact. That resulted in a much larger number of children being identified as close contacts and sent home. Rapid testing cut that down dramatically, because now anyone who's tested negative isn't subject to a close contact quarantine review. It's the positive cases that get subjected to close contact, and as you've heard from Dr. Stoddard, those were really low this past week in terms of our numbers of identified cases. We continue to see a fair number of children going home and being on quarantine. It is a function of their ability to space and to manage the close contact of students during the school day, which is, in all fairness, a challenge for elementary school, which is where our primary areas of concern are, because they're unvaccinated, obviously. So they are still working on it. We're working with them around that and ways to stand up both rapid testing and eventually, as we've gotten to rapid testing, we're still standing up rapid testing. And as we stand it up fully, we will also add to that PCR testing, which will give us a confirmatory test with a faster turnaround time than we might otherwise get. So it'll help to further reduce the number of children that we might have to quarantine as a result of close contact. I think, yeah, I'll stop there.
Thank you. I just also wanted to see if anyone has any specific MCPS student series of questions before we move on to another area of questioning that we received from our members in advance.
I did not have a MCPS specific question, but I did have a question regarding one of the slides that was in Sean's PowerPoint. The slide that showed the current case rates by county, with Montgomery being the lowest, followed by Howard. Are we also currently the only two counties that have a mask mandate? And if so, can a correlation be made between our low case rate or low transmission rate and the mask mandate?
I don't know offhand what the mask mandates are for other jurisdictions in Maryland, but I do know that Montgomery County and Howard County are the two most that with the highest vaccination rates in the state, and I think that being vaccinated is one of the most important things of all the strategies we can do. We've always said once we have vaccine and we can offer vaccinations, it's going to be a game changer. Clearly, with the Delta spread, even amongst vaccinated people, as we've shown here, it doesn't have as significant effects on most people with the Delta spread, but that's why we are still doing the social distancing and the mask wearing, because again, we do have some people unvaccinated or unable to be vaccinated, unfortunately, and we're hoping that we can continue to limit the spread here and not give these variants a toehold and an ability to, again, morph into something that could be even more dangerous to our populations.
So I would add to that it's hard to draw a straight line one-to-one correlation between masks and lower rates of transmission, but it is a combination of things that we're doing: the high vaccination rates in the population, the masks, the social distancing, and a population that's willing to try to maintain some safety up to this point. A group of residents that are willing to help keep each other safe. That is making a difference in this. It's the collective package of things that we've done that make a difference, especially when it relates to breakthroughs. I mean, we've maintained Sean, you'll correct me, about a 23, 24, 25% breakthrough rate. About 25% of our cases are cases that are among folks who've been vaccinated with at least one dose.
Right. I mean, the vaccinate. Yeah. Well, we look at both the rates of vaccinated people becoming breakthrough cases.
Yes.
Right now, it's 0.2% of vaccinated were a breakthrough case over the past month. It was a very, very small number, and 0.02% were hospitalized if they were vaccinated. Our ratio of vaccinated cases to unvaccinated cases is going to be very, very high, just because we have so many vaccinated people and such a small number of unvaccinated. But when you look at how the ratio of who's vaccinated, who's not vaccinated plays into the numbers of cases and hospitalizations, it's very stark that the risk is much, much higher for unvaccinated individuals.
Sean, thank you, because I was about to alarm people unduly. It's the rate of breakthroughs amongst the entire population of folks that's vaccinated that Sean has given you, and that's an incredibly low number.
Yeah, about a third of our total cases are amongst the vaccinated, and the same is true of the hospitalizations. But when you consider how high our vaccination rate is, that really makes it stand out. I mean, you know, only less than 20% of our population is unvaccinated still, and they account for more than half of the cases, or sorry, more than 2/3 of the cases and more than 2/3 of the hospitalizations as well.
Thank you, Sean, for pointing us in the right direction.
A very interesting data point about masking. Carroll County Public Schools, Carroll County being in the Baltimore area to the west of Baltimore County. Carroll County opened without masks. Carroll County Public Schools opened without masks, and they have 8% of their student body currently in quarantine. And you compare that to the other numbers around the state, and while we have more students in quarantine, their system is much smaller than ours. So most school systems across the state are at like the 1% to 2% range of students quarantining. So that's an interesting data point. I do want to share, I'm sorry if this was said earlier, Raymond, I don't know if you said it. I posted the link to the Pulse report. Raymond posted the link to where you can find every Pulse report. So, but what we provided is not the same document that Sean went through. He threw in some extra slides for you.
Right.
So we'll also share that with you. But you can go, if you look at what we put in the chat, you can see the document that put out. HHS puts out this wonderful presentation every week, and so you can access it, and you can access the ones from the last several weeks as well.
And it'll be updated every Wednesday going forward. So
and I posted our chapter survey. So just a plea, if you haven't filled it out, we have 7 municipalities who have. Thank you very much. But I did want to just make sure that even if you're on this call, please feel free to go ahead and fill that out, because that will help with planning purposes. There was another question that we received that I think came from multiple that I wanted to check in with you about. So various municipalities have different discussions that they're having in regards to what they're going to do with employees and the public. Some are considering, are not, just sticking with the masks. Some are sticking with vaccines for employees. Some are exploring whether vaccination attestation is required for entry into public buildings. We wanted to understand where the county is with its employees, and I believe the county executive also had some thoughts that he shared in his update last week, but I haven't seen an update as to timeline and what you all are thinking. So I wanted to pause there and see if you can share with us what you're doing with your own employees and what may be coming down the pike. Do you have an employee wellness policy?
So I will post in the chat the link to our public dashboard on our employee vaccination rates that we now have up. So proud to say 77% of our workforce is fully completely or partially vaccinated. 6% are not vaccinated, and we are tracking everyone else, trying to figure out and get them to report. We do notice, and maybe you've experienced this yourself, that a number of people who haven't reported are from job classifications that are uncomputered. So people whose work rarely has them in front of a keyboard, so easily able to upload their information. So we're trying to go through those, and we're trying to work through the idea of maybe do we have a number of people who are vaccinated by us, especially early on. You gave me the shot, so you know my status. So we're trying to work through that data. But at 77%, while we're on target with, I think if you look at the data that Sean presented in the Pulse report, that is where we are with with both doses or singular J&J. So where our workforce is in line with the overall community, we're trying to work through and talking with our union leaders. All believe everyone should be vaccinated. They're standing up their own peer-to-peer program to first get people to report and second to get people vaccinated. So we want everyone to be vaccinated. And what we're trying to work through is now that what happens now with a mandatory, our approach is still to try to stand up a mandatory testing for people who are not vaccinated, and anyone not reported would be listed as not vaccinated. But like you, we might be working through all of these things like, okay, if you're unvaccinated, but you now have a remote work position and you're not coming in, do you have to test every week? How would we go about doing that? So, you know, there are, for every time you try to do something, there are like 15, well, what about this? What about that questions that we're trying to work through on that front.
The thing I would add on the employee test or employee testing and vaccination front is that our labor groups have been really helpful in actually helping to get some of their own staff to provide the information about status that we've requested. They've been a very good partner in this, and so we'd encourage that for anyone who you know, working with the employees to get more people to participate in reporting their status. But the other thing is, you will, if you watch the last Board of Health, there is discussion amongst some members of the county council about mandating vaccines. And obviously the county executive has also opined on that and said largely that while he supports vaccine, everyone being vaccinated, he also has to consider the fact that he has an EMS system and police system and corrections system to operate, and, you know, doing so without the requisite number of persons creates other unintended consequences. And so while he supports, vaccinations for all employees, he also wants people to get a timely response to a 911 call. And so he's trying to balance those two particular things and thinking about how we increase the vaccination rates amongst our county employees.
So right now it's still test or vaccinate, correct?
That's correct.
Okay. I wanted to pause and see if others had questions on this particular point. And I think I saw a hand up by Olga.
Oh, yep. I was just typing it in. Can you hear me okay?
Yes.
Yeah, okay. First of all, thank you so much for the presentation. I think the excellent work that the county is providing is really a testament to, the numbers that we have seen in terms of the vaccinations. I actually volunteer with Maryland Responds as a vaccinator, so I know firsthand the sites here in the county, as well as other counties. They are very well run, and it's really exceptional. So great job with that. I hear somebody in the background. I have one comment and one question, and this is specific to MCPS, where I do have elementary school age children. In terms of the social distancing, there is an issue, masks are required and worn, but lunchtime in the cafeteria on rainy days like yesterday, that's absolutely an issue. PTA has been really pushing for lunch and other activities outdoors, but the weather can only allow certain activities. But we did not start with outdoor lunch. The PTAs had to push for it. So I do think that collaboration with MCPS is really important. And maintaining good communication, I think, is critical. And that's where I'm getting to my question in terms of the eventual, hopefully, rollout of the vaccination campaign for elementary aged children. I know you mentioned, Sean, that you are working, or the county is working for private partnership collaboration, so that's with pediatricians. But will the county be collaborating with MCPS in terms of vaccination campaigns in schools? Because in terms of access, it really would facilitate it. But I imagine there's many conversations that need to happen. But it would be helpful to know if that is envisioned and what sort of outreach you're trying to support to really get to the children as quickly and as best possible. Thank you so much.
So Sean can join in on some of this, but I can start by telling you that we are in weekly conversation. Actually, we have a weekly meeting with the school systems, but we're in pretty much daily conversation with them about some element of testing and vaccination. And this is one of the conversations that we've been having. Dr. McKnight and I and Dr. McKnight and others have talked about this possibility and the need to do this, and the need to be prepared for the ability to vaccinate in schools. My understanding is she's open to that possibility. We have not worked out the details. There's just a lot to be worked out, a lot of conversations to be had, as you pointed out. But yes, I think there is every intent to do something in collaboration with the schools around vaccination.
And I add on that we have done this when we did the previous rollout of the 12 to 15-year-olds. At the time, we actually had the great fortune that MCPS had an off day the day immediately after they became eligible. We did not have that short amount of time to pivot to be in schools. That was a Thursday. Our clinics were completely full at all of our county sites Thursday and Friday. We stood up sites on the weekends to make them accessible to parents, to bring their kids. And by Monday, we were already seeing that we had hit a very high number of people. Throughout the next week, we continued to see people, but we did plan and did do some vaccination events in the MCPS schools. And they really, really helped us to get to populations who had not come to us previously. At that time, however, we had the luxury that MCPS did not have students on site on Wednesdays. So we did that on Wednesdays when the schools were available. The kids were not, while they were, I believe, remote learning, they were more accessible to be able to come in with their parents. One thing that we plan to do all of this again with the next group. We will partner with the schools about where to go. We do share where we're having, where we'd like a bigger push in the community to get people who have not been vaccinated yet. As you saw, we do track that. One challenge is, and there is a split between parents about whether they feel they have to be on site for their kids to be vaccinated, or they could have their kids vaccinated without being on site. Particularly as we get to the younger kids, it's very important often to have the parents there to help us vaccinate the child. A lot of we do these every year with flu vaccinations with all ages, and the very young ones really do need to have their parents there to help them get through it. Sometimes to hold them while we vaccinate them. So we just want people to keep that in mind, but we absolutely will work with the schools about doing vaccination events with them, and I know they're open to that.
Yeah, thank you so much. And that's a great point about parents preferring to be with their children. I know I had a 12-year-old who needed to sit on his father's lap when he needed to be vaccinated. So sometimes their big kids are still little kids. Thanks.
Thank you, Olga. And I was just going to note on our municipal survey, what's going on in MCPS regarding COVID vaccination testing and the quarantine policy was our second highest area of interest. About 62% of people said they really want to learn more about this and coordinate. So I think although things are changing, I know the BOE is meeting and pushing stuff out. It's an area that I feel like people still want more clarity. So I just wanted to point that out to our county leaders. And I agree that it would be really nice to have traveling vaccine, or sites per school, or even going into clusters so that we can continue to increase that rate. And then also when hopefully, fingers crossed, that we get the elementary students' ability to get vaccinated, that is part of the strategy. I did want to go back to the employee piece and just to note that we had about 4 municipalities who are considering requiring vaccines for employees, and 4 who are doing the county approach of vaccinate or get a proof of a negative COVID test. So just to be clear, in the near future, the county is still sticking with the test or vaccinate approach. Is that right?
That's correct. That is the intention. Now, obviously, the county council could act to attempt to enforce the mandate, and then obviously we'd be having a different conversation. I mean, obviously there could be legal challenges to all those things as well. So I don't want to forestall what would happen in that case. But the intention for us right now is to work with the employees around a testing program to correspond with the vaccination efforts that we've already undertaken, and we'll proceed from there.
Okay, thank you. And then a couple of folks asked about broader vaccination requirements, and they said, when can we go back to normal? Answer, never unless everyone gets vaccinated. And the question is, you know, just if the county is looking at doing broader. And I think part of the reason is if municipalities are thinking about doing something broader for volunteers and people who come into public facilities, it would be great to not have to have a bunch of different platforms to manage that. So just wanted to point that out. And that, Mr. Disparate, I see you raising your hand.
Yes, thank you. Thank you, Monique. Earl, just had a follow-up question for you, please. With respect to the county and your, I guess, the mandatory vax or test policy that you're putting into place, is this strictly for employees on payroll, or will this be intended to also extend to volunteers, boards and commissions, and contractors that might interact with your employees? Please.
Yeah, we're working, actually actively working through the policy with regard to volunteers. We're actually doing we're currently doing a survey of the volunteer firefighters right now. And so the intention in the program, it may look different, and Rich may have some additional feelings about this that he wants to express, and I'll stop to allow him to do that. But it may look slightly different in different groups depending on the nature of their work. For example, we have a lot of seasonal staff who may not be working, or may have, you know, so we're going to probably have the individual programs for the seasonal staff who may not be in work status all the time. We're also looking to exclude certain employees who are, for example, our fire department has a FEMA program where they'll deploy down like they did to Louisiana. And a number of people are engineers in the community who come onto the team and become temporary employees during the period of their deployment. We're likely not going to include those employees in the program, even though they're technically on the county's books as a temporary employee. And so I would say there's going to be some particular special circumstances where the program does not apply, but I do think that we are working to actively ensure that contractors and volunteers will be included as part of the program, just maybe in a slightly different way than the employees. Rich,
and we have rolled out a new policy that all new employees must be vaccinated. So anyone coming on board, you have to demonstrate you're vaccinated, you know, like you have to do on a variety of other healthcare issues when you're hired.
Yeah, and thank you, Rich, and thank you, Earl, for that clarification. Just one last follow-up question to that. Is there also some conversation for your facilities that are open with respect to patrons, you know, customers, others that would come in and interact with your employees? I understand there's the mask mandate in place, of course, but beyond that, is there any conversation about, if not now, but at some point, some sort of verification of either test or vaccination of people coming into county facilities?
Well, we haven't had the county facility conversation. We have had the conversation. We actually had a meeting today with many of the chambers around a vaccine passport program. And one could easily suppose that if we did go down the road of a vaccine passport system, a program, the next natural question is, what about county buildings? Because the premise applies in some cases there. So while we haven't had the conversation, I think it's a natural one that we will be having, not to express the vaccine passports are imminent, But what we're trying to do is have a toolkit of possible reactions should we see a continued, should we see the COVID conditions worsen, particularly not just in the case numbers, but also in terms of hospitalizations. We're really not keen on going down the road of closing county offices, shutting down businesses, limiting gathering size, et cetera, with vaccines available to us. But we are looking to have some number of different tools this year, like potentially vaccine passports or requirements for patronage that would eliminate our need to do those kinds of more broad-based draconian narrowing of people that can be in buildings. And so while we have not and are not imminently considering any sort of restrictions on or any sort of requirements around vaccinations inside county facilities, I do think it is something we will be discussing over the next couple of months, just to have it in the back of our, like I said, and have it in the toolkit so that if things do get to the point where we need to do something else, that seems much more palatable than a broader restriction of movements.
And the reality is, as you know, as you operate as well, we have facilities that, I mean, are we going to tell someone you can't come into the police station when you need a police officer? Or are we going to, someone who's coming in to apply for benefits through HHS? I mean, their entire county council would love to see every person in Montgomery County vaccinated. Our policy is we want people vaccinated. We will come to you. I mean, we have been aggressive. I mean, we have the best vaccine rate in the country for communities of 300,000 people or more, because we have come up with a thoughtful way to find as many people as possible, and we are still trying to do that. But there are limitations and other things we have to do. So we also want to make sure someone who's hungry is getting in the door to fill out their forms for food stamps. that is just as critical a function too. So
there are all kinds of variations on that. We have mobile crisis. We have a crisis center that people can walk in 24/7. And so we wouldn't. I don't see us putting a mandate, a vaccination status mandate on that, because they come in with psychiatric issues, and that's the acute issue. And the staff knows both how to take care of maintaining safety protocols and how to serve the needs of population of folks that come through those doors under those circumstances. And we need to be able to be responsive to the public.
Thank you.
Robert, is that enough? You good? Okay, thank you.
My turn. This is about on-county employees again, and it's really, are you tracking new infections among county employees, especially since obviously the testing or vaccine policy went into effect? And so, have you seen new infections?
We do see periodically new infections of employees, and we are tracking it. We have not seen any. And to be clear, the testing portion of the test or vaccinate is not implemented in all employee groups. There are employee groups that are testing regularly already. We haven't rolled it out in all groups yet, largely because we just finished last Saturday the collection of data on how many employees we need to test. So now we're building out the programming with employees. But we do track as very low in almost all settings, exceptionally low in for example, in fire rescue. We've had very few recent cases because they're so adamant and strict about using personal protective equipment. And so we see a very low infection rate. We just haven't seen enough of the employee testing program to know whether that's going to result in a further reduction, or B, are we just going to detect more asymptomatic cases that we weren't seeing before? So we don't have the data yet to say how it changes.
If the link I shared to our employee testing, our employee vaccination rates, if you go to that link and you scroll up, the next set of data you'll see is our dashboard on employee COVID case information. So it'll tell you right now that there are 59 currently quarantine tested positive employees. and 105 more who are awaiting results, self-monitoring, and quarantining because of a potential exposure.
Right, thank you.
I have a question based on the data that I'm seeing from what folks put in. Are you providing vaccinations on site for employees at this point? I know that that was a big push in the beginning.
We're not, I don't think we're doing anything specific to employee vaccination at this point. So largely it's just the sites that are open to the general public, largely because the vaccine is not trivial to work with. There's a reconstitution process that requires some expertise. So you can't just, it requires medical staff. So we don't have medical, the medical staff that we do have are incredibly busy folk, so it's not a matter where you can have one or two people sporadically around the county, hoping that somebody might come in. So at this point, the vaccinations that we're doing for employees are largely tied into the apparatus that exists for the general public.
Because the demand fell off, we and the numbers of folks that get vaccinated in multiple places, that it wasn't practical to hold open those spaces in small spaces. So we're now in a couple of key locations, up county, mid county, down county, that are available, as well as a number of vaccination sites that are sponsored by our providers. So there's this our providing partners. So there's plenty of opportunities for folks to get vaccinated now. So we didn't see it wasn't necessary to keep those spaces open.
And we actually have had some requests internally, and we've reached out to some agencies internally. As was mentioned earlier with the vaccination rates, we have some employee sectors that communications is more difficult with them. They don't routinely use county emails. So we have specifically done some vaccinations on site with our Department of Transportation and with some of our parks department partners. That was more of the Regional Parks Association, but they had identified populations that had additional difficulties communicating with and had very low vaccination rates. And we went out to those sites and did some vaccinations with them.
Thank you. I had another question. We have several municipalities that have some sort of hybrid where they're providing services and programs, but some of their towns, cities, village hall meetings are still not in person. And so the question we've received is, what is the most important metric we should consider as to whether we start doing meetings in person again?
I would say generally, you should feel comfortable doing some more hybrid activities. And what I mean by that is, think about, obviously face coverings are still required. You can do activities where people come in to I think the most challenging thing that you're going to face is in government, we don't like to turn people away at the door, meaning you got to think about the space that you have and how many people it can accommodate, and whether there's any real risk that you would have too many people for the space that you have to safely maintain, not even the full distancing, but just sort of, if people are going to be testifying with their face coverings off or on, you just got to think through the rules of how that will work, and whether you can feel comfortable that the space that you have available to them is capable of being safe, number one. And number two, as we've all learned, hybrid has opened up opportunities for people to participate in the process of governance, or of government much easier. And so obviously having the hybrid technology that allows you to do both and have an in-person and a remote component, can be a challenge. And the county council is going through that right now with trying to do 2 broadcasts of 2 different committees at the same time. But overall, I think the conditions, we have this in the state of Maryland, the cases per 100,000 is tied for the lowest of any state in the country right now. Montgomery County has the lowest of any county in the state of Maryland. So, our infection rate is incredibly low. Our hospitalization rate is still quite good. Our vaccination rate is amongst the best in the country, if not the best in the country of large jurisdictions. So I think if, for the time period of right now, I think that you can safely do some hybrid activities. Now, The challenge becomes what happens in 2 months from now after Thanksgiving. I think it's anyone's guess. And I think I would suppose that there's probably a fair risk that we're going to see an increase in cases after Thanksgiving as people travel and things get colder. Hopefully by then we've been able to start vaccinating and have gotten a large swath of our 5 to 11-year-olds. Knock on wood, hope that's true. And maybe we don't see the surge, but I would say in the interim with conditions that we're right now, I mean, things are pretty stable, and you should feel comfortable doing some hybrid activities at this point.
I want to underscore Dr. Stoddard's description of this as a situational issue. We've got positivity rates, high vaccination rates, the transmission rates, all, there's some risk, but it's not a zero risk, but there is some risk, but there are also some things that have protected us. And I think to the extent, the vaccination status of the people that you're with, the ability to maintain some social distancing and masks, and when that happens. So after Thanksgiving, I think that there might be a moment for some higher levels of caution. If you've got children that are under the age where they can be vaccinated, that might argue for some additional caution and thinking about how you are gathering with people. But maintaining the social distance and the mask wearing is going to give us an opportunity to do more. My staff and my senior management staff and I do meet regularly, and about half of them come to the meeting and about half of them are hybrid on any given week. So just so that we can maintain some social distance.
Just another question that relates to differences across municipalities. Some are canceling large outdoor events, some are having them. What are your perspectives on large events that attract large groups of people, and is the county planning any large-scale events?
So I was asked about the Wheaton Arts event that was, I think, last weekend, and my recommendation was to continue with an outdoor event. And outdoor events are pretty safe. Now, obviously, if people are, I think we've seen some pictures of stadiums being packed with a low vaccination in parts of the country with low vaccination rates and no face coverings. I think that's a little bit of a different situation. But if it's a outdoor event where you don't have people packed in like sardines necessarily, I think it is a totally reasonable and safe thing to do. I certainly would not recommend the canceling of events, particularly events where you could, in some ways, through process, encourage some distancing between people, and particularly events where you have mixes of outdoor and indoor, making sure that people are stringently wearing face coverings on the indoor portions.
I attended both the Friendship Picnic this past Sunday, but also several weeks ago attended the Ethiopian Day Festival down at the Civic Center. And the Civic Center crowd was much tighter, much more densely packed, and moving much slower through the spaces, even though it was outdoors. So I did what I always do. I put my mask I brought my mask with me, and I put it on when I was moving through crowds where I was very densely packed. The Friendship Picnic was much more lightly spaced and much more spaced out. So it was easier and much more comfortable to move through those spaces without masks. So I think, yeah.
And for those in Down County, the Taste of Bethesda is canceled this year. Yes, it is a very densely packed event with 25 to 40,000 people in a good year. However, the Urban Partnership was having a challenge finding volunteers and partners who could provide staff for key functions like ticket sales. So with that, they had to cancel. It wasn't as much of a health was a concern, but it was more of an operational concern, working with partners and getting them to show up.
All right, I'll open the floor once more if there are any final questions.
One question in the chat about Halloween. So actually, I sent a message today to add it to our list to discuss on our next Wednesday. We have a what we call our letter of approval team, but they're actually a broader based group from regulatory, from Dr. Crowell's department, as well as county attorney's office, things like that. What I would generally say is we'll have some guidance that we'll issue next week. My guess is it will be enjoying outdoor things for Halloween. Outdoor spaces are pretty safe. Minimize the sort of the indoor partying. Really, if you're gonna minimize anything, focus on minimizing the indoor stuff, particularly stuff that you couldn't wear a face covering with or otherwise with a mask. But I think the outdoor stuff, I think will be pretty supportive of most of those activities. More to come next week, though.
Thank you. And Rob, you had a question? And I think Mayor Newton has a question.
Okay, Madam Mayor, why don't you go first?
I can't get my off. Go ahead. I'm good.
Okay, I was just going to ask a follow-up question of the county with respect to facilities that you have for rental to outside groups, whether it's a performing arts type of a group or really any type of outside organization that would rent facilities that the county owns. Is the county implementing or thinking about any restrictions or requirements that on those groups? In other words, would they need to be would testing or vaccination come into the picture, or would you even allow them to impose that, say if they were organizing something and having an event, and we're going to have patrons like a theater group that would bring sell tickets and allow them to require it of their patrons? Has that come up at all in county discussions?
In my most recent conversations with community use public facilities, that part of it was not part of the conversation. One challenge that we're running into is, and for good reason, MCPS is obviously one of the big sources of the rental spaces. They're somewhat concerned about the use of the school spaces for activities, even during out of school hours. So obviously, with their concerns and limitations they place, the amount of events that we can even approve is extremely limited because they're the most abundant of our larger spaces. But in the other spaces that we have looked at, I don't think, and I'll reach out to Director Cup to follow up on this. I'm not aware of any restrictions that we've placed other than the restrictions that face coverings, those kinds of things that are required across the county. I don't think there's any additional things that we've layered on top of the rental spaces, but I'll verify that for you, Rob, and get back to you.
I'm aware of at least one county property that's a county property where the occupant in the property was asking a question about whether or not they could in fact require proof of vaccination for patrons to enter into the space. And our answer on that was that they're renting the space. It is their college, is their business. And so that if someone was renting a space and wanted to make that a requirement, I don't think the county would object to that. Certainly.
Yeah.
Thank you.
If the property specific issue, we encourage any business that wants to impose any additional protective measures that they're welcome to do so.
Thank you.
I think Strathmore is requiring proof of vaccination to attend concerts or events at Strathmore.
They are actually. We just got a text about that 10 minutes ago, describing their system. So
yeah, I think we discussed that Monday night at the mayor and council meeting. But I think maybe, and I have had my screen up because I'm sitting outside, but I've been listening to this conversation, and I may be in the minority, and that's okay. But I am on a completely different side about this. And as the daughter of a 90-year-old and the mother of a soon-to-be mother who's 30, who's due in 7 weeks, and they're living with us while they renovate another home in Rockville, I am very disappointed to see that we are not taking a finer line on this. I think we're waffling. The employees in the city of Rockville have said they are not comfortable with outdoor events because they will be dealing with patrons who are not vaccinated, and therefore we have canceled outdoor events based on their feelings and their concerns about their own health. I am concerned. Fred, my husband, who's 63 years old, healthy, never smoked, all of that, got a breakthrough case in August. I will tell you, he was sicker than a dog for 4 to 5 days. He didn't go to the hospital, but he was sick. He was miserable. Maybe he's a wimp, I don't know, but been married to him for 40 years, so he's not that bad. But I really think we are not taking this seriously for the impact that it has on people. Our insurance rates are going to go up, our health rates, because of the people who are not vaccinated, who are ending up in the hospital for months. I mean, we have to look at this, I think, from a fiscal responsibility as well as the message that we're sending. And I'm sorry, now there's a helicopter. I hope they're not going after somebody, but I mean, taking someone to the hospital is what I mean. But I think people, hold on, I'm going to turn this.
I feel the vibration of that helicopter as well.
I honestly hope it's not an accident, but they're going straight to Shady Grove, so I can see that. But, you know, I really think this is an opportunity for leadership. And I am disappointed to see that we are not in the county being stronger in saying, you need to be vaccinated. I hear that new employees have to be vaccinated. What makes that different than current employees? There's a meme going around with a mom standing there and a little one says to her, "What's that scar on your arm?" And the mom says, "That's my smallpox vaccination." And the little one says, "Why don't I have one?" And the mom says, "Because it worked." My grandfather survived influenza in 1918. My father was just telling us all this story the other day. He was on his way to the hospital when World War I ended. He got in the cab and the cab driver, and he said to the cab driver, "What's all this excitement?" And the cab driver said, "We're celebrating the end of the war." My grandfather said, "I'll celebrate the end of the war and then I'll go to the hospital." And he ended up never going to the hospital, and he survived, and here we are, and yada, yada. But guys, I'm sorry. I really think we're missing the boat in terms of being extremely strong in our leadership. I sent an email to MML today. I'm disappointed that the conference is masks are asked instead of masks and vaccinations are required. There are only 11 elected officials from Montgomery County going to the fall conference because there aren't stronger parameters. I think I'm in the minority here, but I just wanted you to know how I feel. I'm really strongly feeling that we're never going to get beyond this if we don't start taking a firmer stance.
Appreciate that, Bridget. And you know, when I look at the, and as I wrestle with this and the advice to give to the executive and to the council, what is a greater risk to me, a unvaccinated paramedic or no paramedic in the middle of an emergency?
Well, why don't we see just how many, see, because I think it's a game, Rich, I really do. And I think if we have standards and we have rules, I mean, obviously you're not going to be a paramedic in the city of in the county or, you know, whatnot, if they don't have the training. So what's the difference? They have to have all these other vaccinations.
Well, part of it is until very recently, it was just the emergency use authorization. And that has changed part of the conversation once that they got the full authorization. You know, I see your point. You know, right now, because we have worked very hard to assemble PPE for people. We have gotten the vast majority of our employees vaccinated, and I'm confident that even the ones where they're not reporting, they're in concentrations of people that we did the vaccinations. So we're working to identify those people to get them in our database. We give, you know, right now in fire and rescue, there is only one positive case out of all of fire and rescue because of the precautions that they've instituted, because we fitted them out with PPE. I mean, we are managing this well. I mean, if the rest of the country was doing what we're doing in Montgomery County, if we had had the rates, and I forget I saw a national journalist say this, if the rest of the country was Montgomery County, we would be in a totally different position as a country, and we shouldn't lose sight of that.
And some of us might live in the rest of the country if they didn't have those feelings. But here's the question I will leave you with. You said whether it's worst not having a rescue or having somebody there, even though he's not vaccinated. Here's my question. That person who is not vaccinated goes and picks up a senior or somebody who's already compromised or a mother-to-be and transfers COVID, right? Because you don't know it. Fred did not know it when he got it. He only knew it 2 days later when he felt miserable. And then he went and got the test and learned. And he didn't think he had it because he'd been vaccinated twice. And we are super careful. So when he first started having symptoms, he kept saying, I can't possibly have this. I know I was vaccinated. So I just leave you with that. And I'm not taking the night, guys. So I'm sorry I took so long on this. Just my feelings.
God, and we even sent that helicopter over to shut you up, but that didn't happen.
Thank God I'm under a roof. He couldn't hit me.
I could hear it go by too.
That's not feasible, Rich. I thought you would know that already.
Yeah, that's.
I would just say, you know, Mayor Newton, obviously, we've been in conversations for the last 18 months on this pandemic. I very much appreciate your feedback, and I hope that we have generated at least some degree of credibility with the performance of the county on COVID so far. I certainly will make a pledge to you that even though Dr. Gales is gone, I'm sure Dr. Crowel would say the same thing. We're not going to water down our recommendations with regard to protecting the county. And so while we have a difference in agreement on this particular issue with regard to, I mean, it's not even a difference of opinion, to be clear, I support employee vaccinations, or employee vaccine mandates, but I also understand the perspective of the county executive, and frankly, he supports vaccine mandates too. He's trying to, and I think you see this in the Bethesda Beat article. I think his quote was, "If it was a very small number of employees who were not vaccinated who were going to walk away, then let them walk away." That was, I think, what his quote was. And if it's a bigger group, then obviously it's a question of what you do. And so I think there is some credence to the potential that you say there could be a mandate, and you see how many are left, and you make a determination. I think that's a reasonable public policy position to take. We're just not there yet because I think we're trying to still figure out how many employees we're actually talking about before we proceed further with a conversation around understanding the risks and benefits for either accepting a mandate from the council or we're encouraging a mandate or anything of the in between that. So we're going to keep working on this. We're not going to water down our recommendations just because Dr. Gales has moved on to another position. So
you all have really handled this well. And the reason we are in the position in Montgomery County that we're in is because of the way you've handled it. I'm talking about going forward now that we know that it's approved. That's all I'm talking about. So thank you very much. You've done a great job, and I know.
Mayor Newton, I know we should get off of this and let it go, but I just wanted to say that you voiced the frustration of a lot of people about those folks who remain unvaccinated and the degree to which it slows down us being able to get to a different point. And the county executive is balancing between how do we push people to get it vaccinated as fast and as furiously as possible through passports and through vaccine tests, and balancing that against the need for public safety and on other fronts. So it is, which public safety issue are you balancing is what he's juggling with right now, what we're all struggling with.
And he would go vaccinate everyone himself. I mean, he is a strong believer in this. Don't get me wrong. He is, he wants the entire community vaccinated. But he's also trying to balance the overall operation of the organization.
Leaders gotta lead.
Yeah.
Well, I just wanted to thank everyone for being here and see if there are any final questions.
Who's going to win the Stanley Cup?
Well, I want to thank you all in the county, and I know that Dr. Stoddard and Dr. Crowel and Rich and Sean O'Donnell and Ken Hartman, we want to thank you for your time. I know that we often have these in the mornings at 9 o'clock on Thursdays, but it was really important, given what's going on, that we take some time to get you to the larger masses of our chapter. So thank you for being here with us. And just know that we will have more questions. And Rich, in our survey, some folks talked on a couple of other issues in the county. So I'll be in touch with you on some of those questions, and two of them that came out were climate change, given some of the flooding, and also Thrive and attainable housing initiatives. So to be continued.
Thank you. Thank you for participating and for continuing to have this dialogue. We greatly appreciate it. And we have so many other issues to work on, but that's having this dialogue has been great for all of us.
Thank you.
Thank you all. Stay safe.
Thank you.